into a position that's good for my patient, or I can take this entire sterile field, not reaching under, but reaching above, and manipulate it next to my patient. Okay? Do that. Okay. I'm going to open up my swabs, make sure that I can reach them, and the next thing that I'm going to do is I'm going to take my non-dominant hand, which in this case is my left hand, and I'm going to spread the labia majora and, if I can, the minora as much as I can to get good visualization of the urethra. So that'll take a movement like this to separate out. You're pulling apart and pulling up at the same time. You want to bring all that anatomy as far north as possible. You will take one swab and from away from you, from the top to the bottom, and discard. The next swab will be close to you from the top to the bottom. One swipe. And the last swab will go straight down the middle. And with this one, you need to keep your eyes trained right on that vaginal canal because you're hoping to see this iodine pool up and cause a little bit of a sphincter reaction, a wink of the urethra. So you're looking for the urethra to wink at you. And you don't want to take your eyes off of it. You want to try to have mastered that. You can move this piece here. And the next thing that you're going to do is you're going to take this catheter, nicely filled with lube. You see my hands are still not touching the catheter. And I'm going to go ahead and introduce it straight into the urethra. Okay? And I'm just going to twist it and turn it and put it in here. In a real person's urethra, you should approach at a 30-degree upward angle. Okay, these mannequins are different because you have to approach at, let's see, 30, 90, almost like 180 degrees south, okay? But what you want is 30 degrees north for a real human, okay? And you're going to go right into the urethra, and what you are hoping to see is urine return right here, right at this area, all right? As soon as you see the gold, the urine, you pass the catheter 1 to 2 more inches. So I'm going to, now that I've seen this, I'm going to continue to advance my catheter another inch. Get it in there. Now, this hand is going to hold the catheter exactly where it is. If I let this hand go, the natural reflex of that entire musculature right there is going to be to push that catheter out, and it will slide right out. So I have to hold it exactly where it is. And then I'll take my other hand, and I will inflate my balloon, and then I will detach it. Shouldn't have sprayed. At which time, I'll go ahead and take the rest of the plastic sheath off of around my catheter, discard it. Put my patient into a comfortable position, secure this to their leg. Okay, we need to be sure that we've got enough slack here and we are secure. So we don't want anything to be pulling, but we can't leave enough rope out there for them to hang themselves with, all right? So we want to make sure that this is nice and still. We're going to go ahead and remove this. Some modesty here. The other thing that I'm going to note is the amount of fluid that I put inside of that balloon. And it looks to me that I have 2 cc's left, so 8 cc's are in my balloon, and that is something that I would document. And I would document which side I secured the catheter to, how my patient was able to tolerate this. And then I would secure my catheter bag below the level of the bladder to a non-moving part of the bed, okay? So I would choose something that didn't move like the frame of the bed. And I'd like to get it into a spot that is actually a visible part. so that I can monitor it frequently without bothering my patient. Okay? You can provide peri-care after the placement of the catheter because the iodine swabs, if the iodine is left on the mucous membrane, it can cause a chemical burn. So you will want to freshen your patient up, and then you're going to note the date, the time, how they tolerate it, the size. If you were not sure about the size that you put in, it is on the catheter itself. Okay, so this is a 14 French 5 to 10 ml balloon, and I know I put in 8 mLs, and I would document that. And then I would give my patient some instructions. We've put the catheter into your bladder. It will be a little bit irritating for your urethra. It may actually provide you the sensation that you actually need to pass urine. It's okay. Please relax that musculature because there is a catheter in place and it will collect all that urine. So even though you have the feeling or that urgency to go, we have something in place to take care of that. So please don't worry about that. Now if you are having any discomfort, please call me. I'll be in frequently to check your output and empty your bag. When you need to get out of bed, please call me because I don't want you to trip on this catheter. Okay? Call lights within reach. Make sure that there are no other questions, and then I can go. Okay? One more thing with your bag. As it's draining, as you approach 800 cc's, you need to clamp off the bag because you can throw somebody into shock if you allow too much urine to come out at one time. We'll learn more about that when we get to the pathophysiology of the disease process of the genitourinary system. But I want you to know right now that 800 in the bag and you have to clamp it off. And by clamping it off, I only mean that you have to hold it in your hand for 15 minutes and then let it continue to drain. And we do that between 8 and 900 mLs. So if we've got a lot in that bladder and a lot is coming out, then we just stand here and wait until it slows down or stops. And if we get to 800, then we clamp it, wait 15 minutes, and then let it continue to drain. All right. And like I said, you will understand more about that particular process when we get through the pathophysiology of catheters. Okay? Any questions for?
I do, I'm sorry. To secure the catheter,
Yes.
we want to secure it in the hard, clear plastic tube instead of the yellow to allow more movement for the
The
patient.
place that we are going to put our
Stretchy band.
tape
Yeah.
on this is at the Y connection.
Okay.
Okay, because if we allow a piece of tape to go like this,
Yes.
it gets
I was
stuck.
saying more on.
No, we don't.
Okay.
We want it at the Y connection.
Okay.
Now, when we have the fancy clips that come in
That,
the
like,
hospital
Garter
sets,
belt thing?
those are for leg bags for men that have catheters, or for females that have catheters that they're going to be going home with. It's a piece of pre-made tape with a hard plastic Vit clip
Oh yes.
attached to it, and
Clip
that's
it.
what we'll be using in the facilities more than likely.
Okay.
All right, but if we are relegated to just using tape, we need to make sure that we have a piece of tape at the leg and then a piece of tape over this area so that this Y is getting stuck,
Okay.
okay?